Hey everyone, Dr. Charlie Johnson, physical therapist here to walk you through a mind map that I just finished creating as it relates to sciatic nerve stretches, flossing, gliding, sliding. It's called various things, such that you can understand what you should be doing, if you should be doing it at all, when you should be doing it, and when you shouldn't be doing it. All right, I'm going to include also some basic motion or sort of nerve glide progressions, if you will. But I want to give you context. So the main reason I'm creating this video is because this is what I treat all day, every day. Back, butt, hip, leg problems, sciatica being something that can cause all of that. I consult with people all over the world. And a common thing I hear is that people are reaching out to me. They're trying, on YouTube, the top 5 stretches for sciatica or this nerve gliding technique, right? And they're just, they're regretting it the next day when they wake up because they realize that they shouldn't have done that and they are completely worse. So a lot of the content you see out there is, just sort of one-off. It's independent. It's out of context. I'm a past teacher. So one thing that's really important to me is that the people I work with, are educated such that they understand the concepts behind why they're doing what they're doing. So that's really more important for me. So even though we are going to walk through, again, some basic motions that you can try depending on where you're at in your phases of recovery, I want you to understand what you should be doing, when you should be doing it, etc. And I want to give you some guidelines for better understanding that, such that you're in a better place to recover and you're not hurting yourself. So that being said, we're also going to include some live case studies of people I've consulted with in various phases of recovery, such that you can relate and see, hey, I'm kind of like that person or like that person. And, here's what Charlie said and sort of here's what he's thinking. So I want to let you inside my mind. The flow chart is just, I'm a very visual person. A lot of my patients find it valuable. So I want to share it with you such that you're in a better place to heal from this very painful problem called sciatica. So we're going to walk through that flow chart step by step now. Hope you enjoy it. Okay, so here we have it, 30,000 foot view of the mind map that I created. Don't get overwhelmed. We're going to walk step by step through it such that you're equipped with what you need to know if you're going to try to solve your sciatica, specifically as it relates to, hey, should you be doing these stretches? Should you not be doing them? And how should you be approaching treatment? So that being said, I don't want to waste your time. I want to make sure that you actually have sciatica. So this video is only for you if you have sciatica. There's a couple ways to tell. First off, you can see in the little body diagram down here, you should have pain, numbness, or tingling going down your leg. And specifically, it should be worse below the level of the calf, probably all the way into the foot. So usually that's where sciatica causes most pain. You may or may not have back pain, as it's kind of shaded there, but you should have some type of nerve-like symptoms. And you should have a heck of a time trying this motion. Now, the purpose of this video is not to make you worse right in the moment. So word of caution here, I do want you to test this. If you're not already aware that this is a problem, then let's go ahead and let's just verify again so that you don't waste your time. But there is a simple test that you can do from wherever at home there to tell if you have sciatica, or really if there's a nerve sensitivity problem, which we pretty much call sciatica in the leg. So what I want you to do is I want you to take a seat. The name of the test is called a straight leg raise test. Go ahead. In this case, let's just say the pain is in the right leg. Test your good leg first. So slowly straighten out as you're seated, the good leg, and then very slowly stop at the first onset or awareness of any type of symptoms. Go ahead and straighten out the bad leg. And I want you to sort of take a mental note. Is there any type of pain or restriction, while doing this leg raise? And look, if you have no problem with this and you straighten the leg all the way up, no symptoms, no restriction in motion, then you can be 90% or more sure that you do not have sciatica. You probably need to watch another diagnostic flowchart video that I've created because chances are really, really good that it's something else and not sciatica. So now that we got that off the table, I want to kind of review some general sort of guidelines and give you a basic understanding of what's the point of stretching the sciatic nerve or doing these nerve glides or whatever you're talking about, Charlie. So understand that nerves are like rubber bands. So in this drawing, you can see I have that little kind of thought bubble there, that's my brain. And you can see that the arrow represents the nervous system. That yellow line represents the nervous system. So it's just a continuous thing, goes all the way from your brain. At the very base of the brain, you have the spinal cord, goes all the way down through your back. And then there's a bunch of branches, which become the sciatic nerve, go down the back of your leg, all the way to the bottom of the foot to the big toe. And they can cause problems anywhere along that path, okay? Now imagine, right, that I move my head in this example. So if I move my head by flexing my chin to my chest, I can pull that wire or that band or that cord, whatever you want to consider it, upwards a little bit. So, if I had my shirt tucked in and my top of my collar pinned to the back of my neck, I would absolutely be able to untuck some of the shirt from my waist down there. So point is that whether you move the head or you kick the leg from below, point is that you can pull on the nervous system and you can move it. So, ever wonder why maybe you have a stiff neck or you've got some headaches or something like that if you have sciatica as well? Because the whole nervous system's connected. So again, you can influence it from below by moving the head, the trunk, or really anywhere along the path. But this is, something that unites the whole body, and therefore you can use the whole body to treat it, which is good, which is a good thing, but sometimes a bad thing, because as you'll find, if you've looked throughout the internet, most people focus only on the painful area, and there's a lot of other things we can do to move the nervous system. So it's just a continuous loop. It's like a rubber band. We can pull it from either end, above or below. So what is nerve gliding? Nerve gliding, sort of in a real general term, is just the movement of the nervous system and the surrounding tissue. So it's not like you're just like a big, wiggly wobbly nerve. The nerves go around bones and they go around joints and they go through or around muscles. So it's hard to be like perfectly specific when we're doing nerve gliding. We're not just gliding the nerve. We're moving the nervous system and surrounding tissues to reduce swelling. When you have sciatica, you have swelling within the nerve to improve blood flow, improve oxygen, and desensitize the system to motion. So motion that was once, okay, is now probably threatening or painful, and we're trying to get you back to that. So what's really tricky about these things, and why so many people reach out to me and say, Dr. Charlie, I tried that and it made me worse, or I went to PT and they were telling me to do this thing and it made me worse, is because it was probably not artfully applied at the right time, at the right dose, provided where you were at in your recovery. So too much, too fast, more pain, inflammation. Charlie, it didn't work. It made me worse. Too little, there might be no change in symptoms. So some general guidelines. Again, these are general, but look, if there's pain or threat really being the key word there. If you're saying, oh my gosh, this is not good, then please don't do it. It's not an option for treatment. So I know that sounds obvious, but I can't tell you how many times people push into pain thinking no pain, no gain. And when you're dealing with a sensitized nervous system, that is absolutely the worst way to heal and the best way to not be able to walk the next day. So look, if it hurts so good, a lot of stuff out there nowadays, different massage guns or foam rollers or all kinds of funky gadgets and things like that, tend to poke the angry bear. And it hurts so good. It feels so great when you're getting a deep tissue massage or doing it to yourself, but it still hurts. So if you're trying to feel better, that doesn't really make sense. Don't put yucky into the system. You'll get yucky out. Don't do it. Not an option for treatment. If tightness is felt but goes away when you stop, proceed with caution. So depending on, you'll understand what these flags mean in a minute, depending on sort of the phase of recovery or symptoms you're at, it may be an option for treatment. If it's pain-free, then it's always an option for treatment. We'll talk more about this in a moment. So really the process is this. So you want to, have some baseline so that you understand, where am I starting? So when I do something, I can tell, is it working or is it not working? So you want to test the nerve and score the sensitivity. We'll chat about that in a minute. Then you want to treat. This could be any video you find on YouTube. This could be any exercise that you're doing right now, because you want to see, hey, am I wasting my time by doing this? Is it making things better? Is it making things the same, or is it making things worse, right? Do I need to move on, or should I stick with it? So you need to treat it. And then you need to have a process for going back and retesting and kind of rescoring to see, hey, again, same, better, worse, because you want to then follow rules. If it's better, you want to keep going. If it's the same, you might want to change it up or tweak it a little bit. If it's worse, we definitely don't want to do that. We want to test another motion. We keep kind of reiterating this process and going through that feedback loop until we find what's going to work for us. So read this first. So you might be inclined to skip ahead of this. I'm telling you, this is super valuable. There are nuggets along the way. Listen for the nuggets. We will get to the motions. Everybody wants to know the exercise or the motions to do if they have sciatica. That is the least of your concerns right now. The most of your concerns should be that you're focused on understanding what the heck is going on, such that you best prepare yourself with the tools, knowledge, and understanding to find relief. So spend a little bit of time investing in the education up front, and you will thank me later. So get this. Nerves are highly sensitive structures, the most sensitive in the body. You can shake off a little bit of a, shoulder sprain or, a joint that's a little cranky. Nerves, it ain't going to happen. All right. They are highly sensitive. They will tick things off and shut you down. Nerves cause feelings of pain, numbness, tingling, and all kinds of other funky feelings. This creates chaos and confusion. It's not uncommon to have various diagnoses. Depending on who you go to see will determine what you get. Remember, if the only tool you have is a hammer, everything's a nail. Because the nerve travels throughout the leg and create hot spots of pain in many areas that may look, sound, and feel like bursitis, IT band issues, right? So if you go to the hip doctor and you have pain on the outside of the hip, right, but also some other pain elsewhere, they're going to say, oh yeah, they put on their little microscope, you have bursitis. They give you an injection. Oh, it felt good for a moment, but it didn't work because you never had bursitis. Because the sciatic nerve is just a wire that starts in the back and it branches off. It owns all kinds of real estate and causes all kinds of problems. Just get that an upstream problem, a nerve problem that usually starts at the back, not always, but usually starts at the back, can cause a downstream effect. But a downstream problem, for example, a piriformis syndrome will cause a pain in the buttock, but it will not cause pain up the chain. And when I say will not cause pain, I mean it will not refer pain. So if we study referral patterns of where these different problems cause pain, piriformis problem will not cause you to have pain above it in the SI joint or in the back region. I'm not saying that a piriformis or, as we go on here, a plantar fascia problem can't cause you to walk funky and then cause other symptoms. But in and of itself, from a tissue source and referral pain standpoint, something down low here is not going to send signals up. But a problem up here, nerve problem, can cause any type of diagnosis or what appears to be the diagnosis below. So it's not uncommon for people to come to me, say, Dr. Charlie, my doctor gave me a script and it says bursitis, IT band issues, piriformis syndrome, hip flexor tightness. I mean, there's 3, 4, 5 different diagnoses. The person doesn't know what the heck's going on. They don't understand this concept. All right, hip flexor tightness. You think you have a psoas problem. You're digging into it with a ball or something like that. Hamstring strain. Think you have a high hamstring problem, but maybe it's actually coming from above or sciatic nerve irritation. An Achilles tendon problem. The nerve goes right next to the Achilles tendon. Plantar fascia, right on the bottom of the heel. Those nerves, spread out and can cause plantar fascia problems. So just get that the nerve, it travels all over the place and can cause you to be told that you have all these problems, but it is usually just one thing. So you're not crazy, but don't believe all these various things that you've been told until you've calmed the nerve first. How do you know you've calmed the nerve? Because you can go back wherever it is and you can do this leg raise thing and it's pretty darn symmetrical, or there's very little problem. And you're not having the nerve symptoms, numbness, tingling, things like that. Then if the symptoms persist, consider other alternative diagnoses like the ones above. So once nerves are aggravated, they can be difficult and tricky to calm down. You're not doing yourself a favor if you're not sure of what to do and when to do it, and you're just pushing through symptoms. Angry nerves do not like to be stretched or compressed. Glided, maybe, but stretched or deeply massaged, absolutely not. Again, depending on who you see will determine what you get. If you go to the massage therapist, they're going to say, Dr. Charlie, you have, or Dr. Charlie, whatever your name is, you have trigger points in your butt, in your hip. Let's work them out. That's because the nerve, the wire that plugs into the lamp, to the muscles down here, we'll call the muscles, the light bulb, the lamp, right, is malfunctioning, is sensitive. So it's going to make it look like all these spots are hot spots and you have trigger points. It's not. It's driven by an angry nerve. It's not a muscular problem in the majority of cases, especially if you have a straight leg raise, okay? So They don't like to be stretched or compressed. Think of compressed like you're sitting on a tennis ball. You're doing a foam roller. You're using one of those percussion massage guns that are super popular at the moment of filming this. Whatever it is, they don't like it. You can try it, but 95% of people are going to be made worse. So just get that as little as 8% stretch to an angry nerve can reduce blood supply, and 15% stretch cuts off blood supply. If you have no blood supply, you have no oxygen, and that's not good. So it increases pain and inflammation. So this is 0% stretch. This is 100% stretch. 8% stretch to an angry nerve, almost nothing, can reduce blood supply. 15% can cut it off. Nerve problems often cause latent or delayed onset of symptoms. This is why in phase 1 and phase 2, motions, I should put a comma there, motions or any stimulus to the nerve should be pain-free. We'll talk about phase 1 and phase 2. Basically, look, if you're dealing with sciatica in the majority of cases, you're going to want to be really careful, because this is why you go to the chiropractor, you go to the PT, you do these YouTube stretches, right, for the sciatic nerve. And the next day, it hurts so good, or it feels good in the moment, it feels okay, but then the next day, you regret it. And the symptoms are angry, it's pissed off, the nerve is pissed off because you didn't understand this concept. Measure twice, cut once. Always start on the low level of aggression as you treat this problem, and then amp up the aggression as you see that you have an okay response. It's called latency. All right, they have a latent onset of symptoms. But do know this, we talk about all this bad news, right? But it's not bad news, just education. It just is what it is. With or without surgery, most sciatica symptoms resolve with the correct treatment, but it can take up to a year in severe cases to get back to normal. So, if you're having a disc problem and they do a disc surgery to remove pressure on the nerve, there's clear indications for surgery. Let's just say that, there's no loss of nerve function. You're not having terrible weakness. You're not wetting your pants. You have weird numbness and tingling, but it's not like somebody pokes you with a fork and you can't feel it. So you've just got some funky symptoms going on. Surgery or no surgery, most symptoms will resolve within the year, and the outcomes are almost identical. So hang on in there. It is possible to resolve this naturally, without a doubt. So just get that. I don't like the word sciatica stretch. Everybody's looking for that, right? But don't think of this as stretching. If we're going to apply these concepts, we want to think of it as just gentle motion of the nervous system. And again, you can do that from above. You can do that from, somewhere in the middle. You can do that from below. And we'll talk more about that in a second. Okay, so this is super important. Before we even get into any form of, treatment or recommendations as far as potential motions, we first need to identify the phase of symptoms, identify where you're currently at. So I kind of broke it down to three phases based off my experience. Phase 1, we'll call the angry, hot, and bothered phase. So this is recent onset or a flare-up. So this means you could have pain for the past 10 years in your sciatica, but you lifted something, and now 2 weeks ago, you lifted something, and now your symptoms are really aggravated. That would still be phase 1. So recent onset or flare-up in the past, 4 weeks, we'll say. Constant pain. Hard to find a comfy position no matter what you're doing. Moderate to high pain. 0 is nothing. 10 is really, really bad. 5 or 10, 5 to 10 or above. Usually it's more like a 7, 8, 9 if you're in this phase. Significant restriction in motion. What motion? The leg raise. So you'll see here in a moment as I review a live case study of somebody in this angry, hot, and bothered phase. The one leg goes pretty good, and then you'll see for a split second, the other leg goes about this far. Significant restriction motion, no doubt, right? Trouble sleeping due to pain. Pain may even wake you up, and usually does actually. Yeah, you're tossing and turning because you can't find comfort. It's very easy to aggravate and easy to flare. So it's something where, you do a little motion and then you're like, oh man, for the next few hours or for the next day, I noticed that I had trouble, right? So electric shooting, numbness, tingling, jolting, cut my leg off type of level or extent of pain. People will say, hey, it felt excruciating. So when I'm working with somebody, I'm listening to their descriptor of what's going on. So that's generally how people describe it. You may or may not be taking medication for pain relief if you're in this phase. And in this phase, motions or any type of treatment, I don't care what it is. Again, this is just like the tip of the iceberg, but there's many ways that you can approach sciatica. Motion should be pain-free. All right, so now what I want to do is I want to walk you through some live case studies, 2 live case studies of people who are in the angry, hot, and bothered phase, so that hopefully you can identify maybe with something in their story and or sort of how they're moving, so that you can figure out, hey, what should I be doing? How can I properly match what I plan to do to solve this, or who I plan to work with, such that I don't make this thing worse, but instead, obviously, I can make it better. So as you're listening, just key into some words, of high pain, recent onset, not being able to move very well, pain that when they do something, it lingers. Be listening for hints of these things, such that obviously that places them in the angry, hot, and bothered phase. So I'll break it down for you, but here we go. Here's the first one.
It's been about 3 weeks now. I woke up one morning and it felt like I had like a back spasm or something, so I couldn't really move my back.
So 3 weeks ago, recent onset, right? Couldn't really move, even though we didn't get to his leg raise yet. He's saying my motion is significantly impaired.
And then when I was standing up, it was like there was a lot of pain, but I could stand.
Really, really a lot of pain, right? So the descriptor of pain, not just like, oh, it's okay, that might be a later phase, but this is really, really a lot of pain, all right?
Straight and everything. Like there wasn't really any leg pain.
Yep.
And then after about a week, a couple of days or something, the back pain went. So no more back pain. But I realized I was unable to stand straight. So I can't stand straight currently. And when I do try and stand straight now, I have under thigh and left pain in my buttock, and also some numbness now in my calf and the left side of my foot.
So he's describing, right, which is very common, by the way. I had some back stuff, or maybe there were some signs of it. Now I don't really have back pain. Instead, it's more this leg pain. And as you recall in the beginning, a common telltale sign of sciatica versus some other referred pains is that the pain went below the level of the calf. And now he's saying numbness and tingling, nerve-like sensations into his foot. He's crooked.
This is the most I can stand straight.
Okay.
I can't stand, so it hurts me more now. So now this pain here.
Pain starts immediately when he stands on up.
And that's it. So if I try and stand even straighter, I can just feel pain here. That's about it. It's just pain here, but I can't go more than this. I can't lay on my stomach.
So now he's got a lot of restriction in motion. It's very stiff. If he moves certain ways, it's it's very sensitive. Now we're going to look at his leg raise. So symptoms are going, like he said, down his left leg. We're going to look at his right and his left legs, and you'll be able to see a clear difference or a significant restriction in the motion. And then keep an eye on his face too, because that will tell you that he's uncomfortable. That's why in this phase, you want to be careful of testing it. I'm just going to test it one time to get an idea. But I know on the other end, hey, I'm already gauging the treatment. All right, it's hot and bothered. I can't do maybe an end stage type of maneuver with him, because if I go too aggressive with my treatment and his symptoms are too flared up, then I'm going to make him worse. So the examination is going to be somewhat limited in this phase, as you'll, as you probably already learned and or maybe you've experienced, because maybe you've gone to someone and they've done too much and then it flares you up. So the examination will be limited and the treatment will be pain-free, probably away from the area of pain. So many people want to treat the area of pain by doing gliding right directly to the side where the nerve is most aggravated. But really, you can treat various areas. And again, we'll chat about that in a little bit. So here is his good leg raise, and then you'll see his not so good leg raise.
Good leg, your right leg, and slowly straighten it.
Like this?
Yep, like kick it up. Yeah, exactly, man. So we're looking at.
So yeah, there's that.
Cool.
Pretty much.
Cool.
Yeah.
Go to the other leg.
Other legs about there.
Watch his face.
Yeah, I can feel pain now.
Yeah, no bueno. Angry, hot, and bothered. Have to be really careful with the intervention there. Don't go stretching it. Here's another one. Listen to a story.
I don't know if you remember my email, but I put in there that I was moving a bench in late December up a set of steps. It was
at the point that he's chatting with you, I think it's like February. So, within the 6 to 8 week time frame, still relatively early on in the process.
a church pew, an old, probably 200-year-old church pew, very heavy pine.
Yeah.
I was on the going up end, backwards up the steps.
Yep.
And the day after that was when I didn't feel anything when I moved it. The day after that was when I felt an initial hip pain.
Okay.
Then me and my fiance went out of town the next day. And I remember walking around that day, and with every step I could feel just this, small pain that was there. I came home and started, looking up what it could possibly be. And I started doing some stretches. I thought maybe it was just a tight muscle. So I did that for about a week and a half or two.
He thought it was a tight muscle, right? So it's very common. People think they have a hamstring strain, a pull in their buttock or something like that. Nerves can be deceiving. It can make you feel like you have a problem here, but really it's something else. And again, you can get away with stretching a tight muscle, but as he found out, and as you'll learn, it didn't work so well. So he was a DIYer.
Weeks, it progressively got worse and worse. I stopped stretching altogether because I didn't find that it was helping. It was making it worse. It was to the point where every morning when I got up, it was in a spasm. It usually started around 3 a.m. It didn't stop until I had been standing for about an hour and a half.
So 3 a.m. tells you that, hey, even when this guy's not moving, he's just staying still. Symptoms are just brewing. There's an inflammatory process going on. Angry, hot, and bothered. Okay, fair.
And that was all in my hip,
The
upper
right
leg, hip. And with that, I would have the sciatic pain that would go down my leg, down the outside of my calf, and on the top of my foot and the bottom of my foot. The bottom of my foot was mostly like the numb, tingling feeling. That would stick around for most of the day. It would be much better in the evening. The spasms would stop though. Probably I get up around 5:30, so spasms would stop around 7:30. I could tell, and that was after my drive to work, which is excruciating.
Okay. So drive to work, excruciating. So look at the descriptor. He's not saying, oh, it was, just a little annoyed. He's saying it was really, really bad, right? And symptoms, start 3 a.m. The spasms go away kind of around 7 in the morning. But they last most of the day, and as it gets to the evening, it gets a little bit better, but then the process repeats itself. So he doesn't even have to be doing anything really to aggravate these things. Obviously, if he does, he can make it worse. But symptoms just linger. They're just there. Pretty constant pain associated with that phase 1.
That would ease off, and then I would just have the sciatic, and I wouldn't be able to sit because it would bring back the major pain that I would, the major sciatic. So I didn't sit at work the whole month of January.
He didn't sit for a whole month. That tells you he is hot and bothered, okay?
Fortunately, had a standing desk for 2 years.
Cool.
And I could try to go up. I can, but it's...
So that was it. So that's all he had. Look at that right leg raise. That's the best I got, sorry. But look at his right leg raise. This is the painful side. This is all he's got as far as motion.
And I could try to go up. I can, but it's very painful.
Yep.
Very painful.
Do the other leg. So
the other leg, I'm good.
No problem. Normal leg raise.
Yep. So the right leg doesn't go as far as the left leg, and it's painful, correct?
It is quite painful.
Okay.
That would be what irritate. Like I was doing those to try to. I read about sciatic flossing.
Yep.
So I was attempting to do that, but that tended to irritate it more.
Okay. So, just like many of you who are trying to do it on your own and or have gone to a PT, he tried sciatic nerve flossing. By the way, at the very end of working with him, he's now doing really, really well. We are doing sciatic nerve flossing or some variation thereof. But at the current state where he was angry, hot, and bothered, he was doing things that was too aggressive, and it made him worse. He wasn't sure how to match that, appropriately, such that he could get relief and make things better versus worse. Too much, too fast. Phase 2, cooling down phase. So onset of pain or flare-up between 4 to 12 weeks ago. Intermittent pain, low to moderate pain, 3 to 5 out of 10. So it's calming down a little bit. And what I mean by intermittent pain, you might notice that sometimes it's there, other times it's not there. But when it is there, it's not terrible, but again, it's moderate. Moderate restriction in motion. So your ability to kind of do the leg raise and move the nerve, again, it's a gauge of sort of, how you're doing and how healthy or normal the nerve function is as compared to the good side. You might notice there's a moderate restriction in motion. Sleeping better with occasional pains as things kind of calm down. And if aggravated, pain lingers but does not last. So unlike in sort of the angry, hot, and bothered phase, you do something and then you're like flared up, like a crazy wildfire. If you stretch it, or if you do something and you're not aware of it, bend over quickly to pick something up and pull on the nerve. It zaps you a little bit, it lets you know, but it doesn't necessarily last. There's some pain, numbness, or tingling that remains, but again, it's not as intense, shooting or jolt-like. And again, I would say in this phase, for the most part, there are some exceptions, but motion should still be pain-free. Okay, so we just reviewed phase 2, the cooling down phase, and I have one case study of a woman I worked with, or actually 2, I think, who represent this phase fairly nicely. Maybe they're on the transition to phase 3, but let's check it out.
So now do this for me. Now do this, right, and do this.
Okay.
So this is her good leg. No
I will
problem.
say this.
Her
Okay.
good leg. No problem.
I will say this. The left leg raise is still kind of a little tricky, so I've been trying to, work on that.
Okay, so right is a little easier.
Yeah, right is easier for sure. Left is, kind of hurts a little.
Okay, where does
So you can tell a little bit of hesitancy in her voice. If you're careful and just kind of listen to her language, she says, right side or left side's still a little tricky, right? She's unsure about it because it's still a little bit maybe hot and bothered. It's calming down, but she's not so confident in approaching it yet versus people in the final phase where it's old and cold. They just say, oh yeah, it's no problem. I can kick it up, just feel a tiny bit, right? So you can see a little bit of restriction. So it's not terrible. She's getting just, she's got a little bit of a loss of motion there. It's not too bad. She's getting better, but her right side goes up completely fine. Her left side is still a little limited. So here we go.
get you a little bit?
Let's see here.
The left knee can't fully straighten. You see that?
Right down here.
Okay. So again, there it is. It kind of goes away. It doesn't really linger too much. She tested it too many more times than I would have liked. But the point is, it's a good example of you can kind of tell her hesitancy, where she feels it. She still has reproduction of symptoms, goes into pain if we push it. And I would call that like the cooling down phase. So she's not saying like, hey, it's terrible, like it's excruciating. She said, it just feels a little tight and she's got some of the pulling in the back of her leg. Now, the third and final phase, this would be like the chronic old and cold phase. So this is an onset of pain generally like 3 months or more. So, an older type of problem, things are usually simmering down because by 3 months, most sciatica will start to, calm down or quiet down. There's intermittent pain that is only reproduced with stretch or specific motions of tension. So if you're standing there and you say, hey, I'm fine. But if I go to run and kick my leg out, or I, go to touch my toes, I feel it, it's there. It's not too bad. It's, low level, 0 to 3 out of 10. And then when I come off of it, pain goes away or returns to baseline quickly once I'm done. So there's minimal restriction in motion. You might just notice that pulling on the nervous system at the very sort of extreme of motion. So really, you get into the slump position if you've looked around, for various stretches or interventions for sciatica. So you're sitting there and you very end, you really bring your chin down when your leg's straight. Maybe that brings on some calf or some buttock or some hamstring pain. Or, you kick your leg out and you really have to pull your toes up to feel anything. That's kind of what we're talking about in this phase. The leg might feel tight, but there's minimal to no pain. And motions in this phase, I say, may touch the pain. You can go right into the edge of it, but symptoms should resolve once completed or pretty, darn soon thereafter. So it should be like, there it is, it's on, there it isn't, it's off. And again, I'll show you an example of this. Okay, so another one here, I'd call this phase 2. Maybe she's headed for phase 3. You'll be able to see that things are, definitely calming down. But let's watch to see her restriction motion and kind of her descriptor of symptoms. This is phase 2, headed to phase 3. Her left leg
So what I want you to do is go ahead and show her
her
how you
left leg
move
is
your
the bad
good
leg,
leg, which you have no pain, numbness, or tingling down.
Okay.
So this is your good right leg. Go ahead,
Yep.
straighten it up. Cool. Any pain or problems?
Nope, nothing.
Cool. Just a little tight in the back of the leg?
Yeah.
Go ahead now and show me the bad leg, the one that had the bad pain, numbness, tingling, the bad sciatica when we started. Okay, cool. So stiffness there still, but is it, mild, moderate, really bad pain when you...
No, it's just a little bit. I just feel a little bit of a pull back here.
Cool,
And then it
okay.
goes away.
Yep.
Bad question by me. I should have asked her to just describe the symptoms versus leading her into, hey, pain. She said a little bit of pull. She corrected me. So a little bit of pull in the back of the leg. There it was. there it wasn't. Okay, so she's more phase 2, cooling down. She did have bad pain, numbness, and tingling. Now you can still tell she can't get her legs straight. She's restricted compared to her right good side, but she's headed towards healing. Okay, final phase, the old and cold, the more chronic injury here. Still maybe notice some end range limitation in motion if you bend down to pick things up, etc. But overall, symptoms are much less. Let's listen to the story of a woman who I've worked with who, at the point of shooting this video, is in phase 3 of healing. We can get away with doing some more aggressive things. Watch and listen carefully. That's her bad side.
They had me doing this at physical therapy, and I remember doing it just on this leg, but they had me flexing my foot, and it hurt, like that, like flexing it, like I'm not going to do it.
Okay.
Yeah, so is that same, better, or worse?
So she just said something that you might be saying. I went to PT, I did this thing. Notice I'm having her do it. And actually, watch.
I would say it's higher now. It feels like the motion's better.
I had her retest immediately afterwards because I felt comfortable with that. And me doing the same thing as she was doing pretty much before, slight little change, now helps her, right? So interesting how it's not necessarily what you're doing, it's how you're doing it, the art of dosing it, the frequency, the timing. You've got to be precise in that, okay? So again, if you need more help with that, check out the links in the description. But that being said, old and cold phase, she just said she went to PT, she was doing it, and the problem was that they were doing too much, too fast, they were too aggressive, they didn't respect where her symptoms were and kind of where she was in the phase of healing, and they were making her worse. So not a bad exercise, bad timing on their part. Okay, so now we've reviewed the phases, we need to go back to the process. So this is a big issue. A lot of people, they do way too many things. Healthcare providers recommend way too many things, and patients, when they're trying to fix themselves, they just have usually no idea what they're doing. I'm trying to change that a little bit for you. But again, they do too many things because when you're in pain, you tend to go insane. It's not your fault. Everybody does. And you start getting caught up in the confusion and chaos of just trying to solve this problem. So if you're doing a whole sheet of exercise and it's not working, go back to a simple process. Bring some clarity and some calmness to the approach that you're trying. So you want to test it. Again, I'll talk about that in a moment. You want to treat it. It doesn't just have to be what I'm talking about here. It could be something you're trying already. You want to have a process, though, to plug that into, and then you're going to retest such that you can determine, hey, are things better, same, or worse? And obviously, there's some basic logic and some rules that will follow as we talked about. So that being said, how do we test the nerve sensitivity? Well, leg raise test is an easy way to test how good the nerve is doing or how sensitive the nerve is. So again, do this on the good side, and then you're going to do it on the not so good side. The bad side, but you're going to do it very, very slowly. Stop at the first sign or onset of symptoms. And you're going to be thinking as you're doing it on the scale of sort of 10 to 90 or 0 to 100, if you want to say that, yummy to yucky. Yummy is like, hey, no pain or problems, a yummy motion. A yucky motion is one that is like painful for sure, numbness, tingling, threatening. As you do the leg raise on the not so good side, rate it low, medium, or high, 10, 20, 30. If it's low. If it's medium, 40, 50, 60. If it's high, 70, 80, or 90, and record that somewhere. So write it down so that you have it. So now we want to begin treating or begin some type of approach because you're wondering, okay, so I've identified the phase symptoms and I have this process, but what the heck do we do about it? So I want to give you some options depending on the phase. So we'll talk about this in a moment, but just remember phase 1 is indicated by the red flag, angry, hot, and bothered. So these are 2 options that you can try, and we'll walk through them. The yellow flags indicate the cooling down phase. So symptoms are a little bit better than when they started potentially, but still not so great. And the green flag, minimal symptoms, the old and cold phase, and I give 2 options in that phase. Again, though, remember, these are just a couple motions. There are many, many motions that you can use to try to solve this problem. So, if you're going through the process trying to solve this and you want to give these motions a test, cool. If you don't, check out the links below to see how we might be able to work together in some way. But that being said, you give these a go, and if you're not getting the results, don't be discouraged. No big deal. There are many other ways, again, that we can look at this and angles we can take. So what you want to do is you want to start with motions that feel good and pain-free and progress as tolerated, one motion at a time. When you find a motion or a starting point, you can treat 2 to 3 times a day using that motion as long as, again, it's pain-free. phase 1, 2 times 20 reps or 2 times 30-second holds. So that's where we're going to start. So the leg raise, for example, this is something that I would recommend you start with doing on the good side. So in the example that I already showed you, it was on the right leg where the pain or problems were. But I want you to start laying down or even seated and just kind of, kicking, holding the back of the leg and kicking the leg up on the good side on your back. Or you could just kind of hold it there with the leg straight and do some type of repetitions like this. So reps like this or reps like this. Or obviously, if you're going to hold it, you would just hold it there. All right. And some people are like, well, that's kind of weird. Why would you treat the good side to help the bad side? Well, there's some good evidence that when it comes to the nervous system, you can actually, by working the good side, when you pull on the nervous system on the good side, it actually helps slacken the nerves on the bad side. So it can actually give some relief to any type of strain or tension that's on the nervous system on your bad side, which can obviously in the angry, hot, and bothered phase, that's kind of nice. The nerve doesn't want to be lengthened. So if we shorten it by working the other leg, then that's a possibility for treatment that maybe you haven't thought of. So I want to change your perspective around this. So what you're going to do, right, is you've already tested. You're going to go ahead. You're going to, do that leg raise, either reps or holds. You choose. And you're going to do it for, if you choose reps, 2 times 20 reps, or if you choose holds, 2 times 30-second holds. And you're going to do that as long as it's pain-free, especially in this red flag phase, the first phase. You're going to treat it for 2 to 3 times a day. And then what are you going to do? The next day, let me say it again. The next day, you're going to retest the nerve sensitivity 1 time, score and record it. Again, if you have some other ache or pain in the body, you might be okay with testing, treating, retesting immediately to see what happens. But in this case, because it's a nerve problem, treat yourself as long as you're doing okay and things aren't worse at all when you're doing it, right? This is why I start pain-free. Remember that latent effect. We don't want to do too much too fast. Test the motion, treat it, and then wait 24 hours at least to retest it to see then what's happening. All right, that'll give you a better, bigger picture look at what's going down. So go ahead and do that. Now, look, if it's better, right? So we got to go back and we got to follow the rules. So if it's better, then keep going with that. Seems to be helping you, right? If it's the same, you say, Charlie, I tried that leg raise on the good side and didn't do anything. And I did the reps 2 times 20. Then I'm going to say, hey, no big deal. Just go ahead and switch it to holds. Or if you started with holds, 2 times 30 seconds, go to reps. So just change it up a little bit and just make sure that that motion is something that's not going to work for you. Okay. And then again, wait 24 hours, retest it, same but or worse, go back to the rules. If it's still the same, then you can go to another motion. All right. Okay. So now let's just say we've worked that motion. And Charlie, same, whether you holds or reps, or for some reason it's painful, or something funky happened, I'm going to try the twist. So again, this is seated. You could try it standing if you wanted, or even lying down. But point is that what I want you to do is I want you to treat, you can see, twist to the yummy side. And what I mean by that is sit, twist to the right, twist to the left. And for me, twisting the left, I don't have sciatica, but is a little bit stiffer. It's a little bit yuckier. So I would call the right side just a little bit more loose, a little bit easier, less restricted. All right. So what I want you to do is I want you to go ahead and treat using the twist to the good side. So again, you're going to choose either 2 times 20 reps or 2 times 30-second holds in this red flag or kind of acute hot and bothered phase. You're going to do that 2 to 3 times during the day, as long as, again, it should be completely pain-free. And you're going to retest. If it's better, you're going to keep going. If it's the same, you're going to change from holds. So record what you did and you'll go to reps. If you did reps, you'll go to holds. And if it's still the same and you retest, go to another motion. And where do you go with another motion? That's a topic for another video because the possibilities are endless. All right. So again, check the link below if you need help at this point or you're confused for some reason about how I might be able to help you out. All right. So next phase. So let's just say that you're not here, Charlie. I would still recommend, by the way, that if you think that you're in the yellow phase, still try these things. You might find some benefit from them. But if you want to risk it and you want to be daring, then okay. But warning, you can go ahead and give the squat a go. So you can see here delineated by sort of these yellow lines. This is representative of the nervous system and the tension points as well as the slack points. The tension point here is going to be in the buttock, a little bit in the lower back. My head is kind of neutral. So if I was looking down, it would be a lot of tension up there too. So just keep it neutral. But then because the knee's bent, it's sort of slackened, and then the ankle's pulled. So it's a little bit taut. So tension, no tension, tension, right? So what's nice about that is as you're moving, you're kind of giving a nice little slide or glide effect, because some areas are a little bit taut and some areas are a little bit slackened. So it's a very low on the potential threat scale, if you will, as it relates to this phase of healing. So what are you going to do? You're going to, you've already tested the body. You're going to treat using this motion. Now, look, if you can't do reps 2 times 20, you want to do 2 times 10 or 2 times 15. That's okay. I'm just giving you basic guidelines here. Or you could choose, again, if you can't do holds 2 times 30, that's kind of weird. So that's why I say, hey, in phase 2 or phase 3, reps only, no holds allowed, because trying to hold a squat for 2 sets of 30 seconds when you have potentially an irritated nerve and you're not feeling too well is maybe not a good idea. So in this sort of yellow and green phase, flag phase, I just say reps only. But again, if you need to modify them to your ability, then that's perfectly fine. So again, you're going to go ahead, you're going to test it, right? If it's better, retesting 24 hours later, still that 24-hour retest rule, then you go ahead and you can keep going. If it's the same, then you could tweak it. What do I mean by that? Maybe you don't go as far. Maybe you go a little bit further, right? Again, it should be pain-free though. Go back to the guidelines and you just, test it out a little bit. So you can retest. If still the same, go on to another motion. Charlie, the squat doesn't do anything for me. Well, symptoms are cooling down. So I'll give you the benefit of the doubt. All right, we can go ahead. Let's try this idea of something more traditional as it relates to a nerve floss or glide by doing this motion. So you want to take a seat somewhere, well supported, straighten out. In this case, we've moved to the bad leg, but notice that the foot is relaxed. So we've got tension up here, but then we've got some slack, sort of through the calf area and the foot because it is relaxed. Versus if you pull it up, as you'll see in a moment, it creates even more tension. So starting with the foot relaxed, very gentle, again, just shy of symptoms and off. Just shy of symptoms and off, 2 times 20 reps. You're going to do that 2 to 3 times a day as per your tolerance, as long as, again, nothing should be worse in the moment at all. It should be on and off, and then you can retest, same, better, worse. And you can decide, following the rules, do you need to move to another motion or not? And again, other motions, we need to chat about that, but there are many other options. So don't discourage if you try these things and you're still in need of some guidance. It's completely normal. Okay, so now you're in the green phase, old and cold. Things are pretty good. They're almost back to normal, Charlie, but my leg raise is still a little iffy. You can go ahead and you're probably okay at that phase or at that point to work into some type of restriction. So now I increase the tension. Whereas before in the yellow flag phase, if you will, the cooling down phase, we had the foot pointed. In this one, we pull up the foot to just add a little bit more tension, provided the symptoms are calming down. So just get that if we look out or if we zoom out, low aggression, low potential or low risk. So low aggression, low risk. As we slide to the right and we kind of end this bottom corner one with the max tension here, I'll chat about in a second. That's high aggression, higher risk. And really the risk is determined on when you do it. So, at the end phase, this might not be too high of risk. But if you're watching a video or you're being told by PT to do this slump maneuver and you're in the red flag phase, you're in that acute hot and bothered phase, then the chance of you making angry is very, very high. So in that case, it is very high risk, very little reward because it's way too aggressive. As symptoms calm, we can start to increase the level of aggressiveness as far as increasing the tension throughout the nervous system. So hopefully that's helpful. So again, you go ahead, you treat this with reps, 24 hours later, same, better, worse. And then the last thing, if you really want to give it a go and you feel like, again, it should be on and off in this final phase, you start, with the head kind of pre-tension, a slump position, straighten the leg and off, straighten the leg and off. There are many different ways you can do it as well, but this is just a basic demonstration here. This is max tension because the head and the foot are kind of pulled, and you can imagine that wire is completely, or that rubber band is completely on tension. So the very final move that you would want to consider, and only when you're almost fully recovered, such that you can gain back full nerve motion. Okay, so that is the end of the mind map or flowchart walkthrough. Hopefully you found that valuable and helpful. If you did, just like or comment below. That being said, 3 reasons as it relates to movement as medicine that people do not recover is number 1, they mismatch the motion to their phase of healing. So if you're in phase 1, the acute phase where things are really hot and bothered, and you're doing, phase 3 treatments, then you're going to have a clash there. You're going to become, say, worse. If you're in phase 3, old and cold, and you're doing phase 1 motions, you may not be challenging the system enough to see improvement. And at the end of the day, what it ends up sounding like is this didn't work, all right? But it can, perhaps there's just a mismatch of where you're at and what you need to be doing. So the second thing is that you've just run out of motion. So depending on who you go to see will determine what you get. So if you go to see somebody who specializes in a certain treatment method, or say a massage therapist or a chiropractor, well, they only have certain things within that toolbox. And if they run out of tools, or in this case, motions or strategies to provide you with, and those things don't work, then, potentially you think that that thing doesn't work, or that conservative treatment won't work. But in fact, it's just that you didn't have a large enough toolbox. So it's possible you just ran out of treatment options. And the final thing is that you haven't plugged this concept of using movement as medicine, as we just described, into a larger system or framework for addressing the problem. There's really 3, maybe 4 main steps to getting you back to normal. So step 1 is we have to, what I call shift pain triggers. We have to figure out what's aggravating the problem in your environment, in your life, and find ways and strategies to modify that such that we're not constantly nicking the scab. That's the first step. The second step is what I call a total body scan. It's this idea that we need to teach you how to not only assess the leg raise, but the body in whole, because the whole thing is connected. The next step is going to be, again, movement as medicine, this idea that we need to systematically work through motion such that we know what the cause and the effect of that motion is for same, better, or worse, and then decide what to do from there. And then finally, step 4, reboot system. We need to figure out how to get you back to life. So if you're looking to sort of complete the picture for yourself, and you're looking to solve this problem once and for all, and have been wondering why you haven't been getting better, then go back to those 3 possible reasons within just the movement as medicine, but understand that, again, this fits into a bigger picture process. So if you'd like more information about how you can work with me directly and or how I'm able to help you out, just check out the links below. Make sure that you subscribe for more like videos, and comment /like if you found this useful. Until next time, thanks everyone. This is Dr. C. Take care.